Narcotic analgesics were designed to relieve pain. They act on the brain and spinal cord to dampen the effect of painful stimuli, thus masking pain. So why might performers take narcotic analgesics? They increase the performer's pain threshold, they give a sense of euphoria, they give a sense of being invincible, and they mask injuries so the performer can continue to compete. So what are the health risks associated with these? Reported side effects include nausea and vomiting, anxiety and depression, kidney and liver damage, addiction, concentration loss, and further damage to injury due to masking of pain. So who might take narcotic analgesics? Sprinters, boxers, footballers, and swimmers. In fact, any performer with an injury who wishes to carry on training and performing could be tempted to take this category of drug. The key thing to remember is that narcotic analgesics are painkillers. They mask pain. Okay, the next drug we're going to look at are peptide hormones. These are a naturally occurring hormone within the body. So there are two types of peptide hormones you need to know. Erythropoietin, which is EPO. Remember, in your exam, you are allowed to write EPO. And the other one is human growth hormone, HGH. So why do sports people take them? Erythropoietin, EPO, can help increase red blood cell production and therefore increase oxygen delivery. Human growth hormone can help increase muscle mass and therefore strength and burn more fat. So what are the health risks associated with peptide hormones? EPO increases thickness of the blood, which causes blood clots, strokes, deep vein thrombosis, and an increased risk of heart attack. HGH can cause arthritis, heart failure, abnormal growth in feet and hands, and diabetes. So who might use peptide hormones? So people may use EPO in any activity where an increase in oxygen delivery would be helpful. For example, rugby, distance running, distance cycling. Human growth hormone would be used with any activity where an increase in strength would be helpful. For example, sprinting and weightlifting. Okay, so the next drug we're going to look at are stimulants. So stimulants are a category of drug that temporarily elevate mood. They increase brain activity, making an individual feel more awake and more alert, as if they had more energy. The taking of stimulants in large enough quantities constitutes the use of performance-enhancing drugs and is therefore banned. So why might performers take stimulants? To increase alertness, be it mental or physical. This will enable the performer to respond quicker, to reduce tiredness, to increase heart rate and therefore oxygen delivery, to increase competitiveness, to increase levels of aggression. So what are the health risks associated with stimulants? Insomnia, aggression, anxiety, and heart rate irregularities. Who might take stimulants? There are two main areas where stimulants might appeal to performers. Where an increase in aggression would be helpful. It helps to have a certain level of aggression in very physical sports as the performer is more prepared to take physical knocks. For example, rugby, boxing and ice hockey. The second area is where the performer needs to stay alert over a long period of time. For example, long distance cycling or baseball. The final performance enhancing drug we're going to look at is blood doping. So blood doping is different to taking performance enhancing drugs, as it is a method that is followed rather than something you take. It is a process some athletes will use to enhance their performance. This method, like PEDs, is banned from use in sport. How is blood doping done? Blood doping can be done in a number of ways. For example, using the performer's own blood. The performer has his or her blood removed and stored. The body replaces the blood over a 4 to 6 week period. Prior to an event, the blood that was removed is injected back into the bloodstream. The performer can also use the blood of someone with the same blood type. Blood is put into the performer's bloodstream via a blood transfusion. So why do performers use doping? There is an increase in red blood cells, so therefore there is an increase in oxygen carrying capacity. So what are the risks associated with blood doping? Infection from equipment leading to blood poisoning, increased thickness, viscosity of the blood due to an increased number of red blood cells, deep vein thrombosis due to blood clots, stroke as a result of blood clots, and diseases carried in bodily fluids, for example HIV and hepatitis. Who might use blood doping? Any performer who takes part in an activity where an increase in oxygen delivery would be an advantage. For example, long distance cyclists, long distance runners, and games players where the game can last for hours.